are here and those who are on with us on the webinar this evening. Tonight's webinar is going to be on throwing, injury prevention for the young throwing athlete. Let me get rid of this. A little bit about myself. So I'm a former baseball player, played Little League all throughout my younger years, played through high school, but then once I entered high school, I knew that I wasn't going to be the next Johnny Bench, which I wanted to aspire to be. So I took up academia and decided to go this route. But I love baseball, and I think it's a great game. By training, I'm a licensed physical therapist. I'm a high school strength and conditioning coach, and I'm also like a certified strength and conditioning coach through a national organization, National Strength and Conditioning Association. And I'm also right now a clinic manager of Walnut Creek Satellite Clinic, the sports medicine center for young athletes. Okay, so this is just our disclaimer. You know, any information we're going to get tonight is just for educational purposes. All right, so our sports medicine center for young athletes, what we do is we're a comprehensive sports med rehab center, and we do physical therapy, we do sports training, we do some injury risk assessments, and then also we do some preventative classes as well. And so we're pretty much overall, we're just a very dedicated practice for young athletes. And we have multiple locations. We started here in Oakland. This was our initial center, and then we moved out to Walnut Creek, and that's where I reside now. And then we just recently opened a San Ramon campus as well. So the first part of our talk that we were going to go through was just like the growth plate injuries, and then I'll touch on a couple of those, and then we'll go into another injury that you're hearing a lot of these days as well. So right now, we'll talk about like just the concept of the growing athlete, the growing overhead growing athlete. So the growth plate here, as you can see, I can get my pointer, is we've got these centers here in the areas where bone growth occurs, and we call these the growth plates. And these are the areas, and this is a left-handed model where we're looking at the elbow and the upper arm and the forearm bones. So we're looking at a lot of stress that happens along these growth plates. Especially in this case, we're going to talk about here at the elbow, and we'll also talk further up into the shoulder. And there's a lot of stress that happens in the young athlete when they're throwing a baseball. It's really an unnatural activity if you think about it. So a lot of stress on both shoulder and elbow. So the areas of bone growth is, we talk about the growth plate as the physis, and then we have and this is the areas of the long bones where they grow. So the growth plate's here, and then you've got the shaft of the bone here, and then the end of the bone here. So you're going to get bone growth on both ends of that growth plate. And it's very vulnerable to injuries when we're growing. And a specific injury that we encounter here is Little League shoulder. And then when you're talking up at down at the elbow, we've got these areas where, again, it's a growth area. It's called an apophysis. And this is an area where a tendon attaches to an area that's underlying this growth plate. So we've got the growth plate here, and then we've got this piece of bone here, and you've got the tendon that will attach to this area, and it's weaker. It's weaker muscle than tendon. So what we'll see here is we'll see a lot of these injuries to the elbow. Now we're working to the shoulder into the growth plate here, and we're looking at what's called Little League shoulder. And this is an injury to this area. It's the growth plate up here. It's the proximal physis in the humerus, or the shoulder bone. And then you get like a little fracture here that's going on, and it's due to overuse. It's failure to like monitor your pitch counts, and we'll go through a lot of these risk factors a little later as well. A lot of times the young throwers don't have enough rest, so they're also going to do undue stress to this area as well. This area is a big point these days, breaking pitches, breaking balls, curve balls before skeletal maturity. And then also during the growth spurts, when the kids are, growing in between the ages of 11 and 14, we see this quite a bit as well. So when when we see the kids in our clinic that have this condition, little league shoulder, we look at the symptoms that they come in with. They come in with this sensation like, well, it's like a dead arm. I can't use it. I can't throw the ball. We also see that they have this, it's a gradual onset of pain when they're throwing. And then we also have, it's localized pain. If we were to go back, let me just go back real quick. And along this area of the shoulder is where you'll have that point tenderness, around where that physis is. And then the pain gets worse as they increase the velocity of throwing and the duration of their throwing. Now, the little league shoulder, what we do is when we're trying to treat this, we have a young athlete coming in and they have this condition. So what we're thinking of is we try to do it conservatively on the younger athletes. And these are the athletes who have, like, typically, they'll have a little bit more than like 4 more years of skeletal growth to occur. And what we'll do is we'll kind of like short course immobilization maybe, and start getting them actively moving as quickly as we can. And then over the course of the 3 to 4 months, and it's a fair amount of time to try to get them to return to sport. And then with the kids who are close to skeletal maturity or they have like a larger deformity, then what they'll do is they'll do this procedure where they do like percutaneous pinning. And they'll go in there operatively and put these pins in, and then they'll go ahead and let that heal over the course of 4 to 6 weeks, and then they remove the pins to make sure that it's adequately healed there. So just like for little league shoulder, like in summary, and again, this was information that I received from a well-known local surgeon. So the average duration is about 7.5 months to get through this. And the treatment's going to be rest. You have to have relative rest going on, not picking up the ball, throwing it, and then physical therapy as well. So on average, we're looking at a few months of physical therapy. And it's been proposed 91% of the individuals who have little league shoulder will actually return to competition in baseball and be asymptomatic or not have any pain anymore. So the next thing we talk about is around that apophysis we were talking about at the elbow. And again, it's that area where the growth center is. And this is a traction area along, again, we're looking at that left elbow. In this area, you've got this tendon attachment, and it will pull on that growth center there. So it's a traction of that bone where the tendons of the wrist flexors. If when you throw a ball, you have to use these muscles and these tendons that come across the inside of the elbow attached there. So you're going to get a lot of stress in that area. Typically, it's about 8 to 16 years old. We see these kids coming in. And the pain, again, is on the inside of the elbow. And you'll tend to have them come in, and they can't fully straighten their elbow, or they feel stiff. It's like, it just feels stiff, or I can't extend it all the way. You could or could not have swelling. You don't have to. Sometimes we'll see some swelling around that inside elbow area. And then they'll also, depending on the severity, sometimes we'll have some irritation of a major nerve that goes in there, and you'll start getting some numbness into the little finger of the hand. And a lot of times, some of the contributing factors this is when you're going to accelerate the ball, you get all that stress on that elbow when you're first accelerating, and you start getting a lot of this like torque on the elbow. We call it valgus stress. And then when you're laying back into the like when you go to release the ball, sometimes you'll get that too. I got this from a study from Lyme in 2001. He said even like the slider, throwing a slider gives you an 86% increase of that elbow pain that you would encounter in this condition. So wise, we're looking at relative rest. So we're talking about 4 to 8 weeks where we're kind of like shutting down throwing. You're not going to pick up a ball. You're not going to throw the ball. But what you can do is you can do other things. You don't have to sit in front of a TV and play video games. Just be, a bump on the log. We can do some core strengthening. And then once your shoulder and or in this case elbow feels okay and it's not painful, then we can start integrating some strengthening. We can start doing some scapular or some shoulder blade strengthening. We start doing some rotator cuff stuff, and then we can start integrating a little bit of this shoulder stretch that we show on this right side. And the reason why we focus so much up in here in the shoulder blade area, because you're thinking, well, my problem's down my elbow. Well, because there's so much stress being caused at the elbow, because not much is being worked up at the shoulder blade, you're not getting that good stability into the shoulder blade. The core's not firing the right way. So you start getting a lot of undue stress in the elbow. So that's why we tend to work a little bit more on these areas. And then the elbow pain is going to go away because we've taken away some of that stress from the elbow when you're throwing the ball. So like we were talking about this picture here, this is kind of like one of those internal rotation stretches we do to try to restore motion at the shoulder. Because when you throw a baseball, it typically will lie the shoulder back, and then when you come through, repetitively throwing a ball, you tend to get a little bit stiffer going into this direction. So over the course of a season, we highly recommend our young athletes to start working a little bit on restoring some of that motion. And this is one of the safest ways we found to do this. Okay, and then what happens is, when they've been in physical therapy for a period of time, 4 to 6 weeks of PT, then we start getting them into looking at their throwing mechanics. And we've got some really good resources that we have to look at throwing mechanics. Because as physical therapists, we know the basics of throwing a ball, but we absolutely don't have those insights as to subtleties of throwing a baseball. So we have resources for that. And then we'll also start them on an interval throwing program once we know that mechanics are looking pretty good. In severe cases, they're looking at like if there's like an avulsion, which an avulsion just means like if a piece of the bone was actually pulled away from the remainder of this elbow from that traction stress on that from the tendon. And then if that's the case, if it's avulsed, then they look at possible surgery. Okay, so this was that third injury that we typically, it's well known, it's well documented, you read about them all the time, and unfortunately they're happening at a high rate, and they're becoming younger kids that are undergoing these surgeries and the injuries to begin with. So we're looking at the UCL, or the ulnar collateral ligament injury, or the Tommy John injury. And what we look at is, the Tommy John, I tried to pick a better picture. I don't like him in a Yankees hat. I'd rather see him in the Dodgers hat. Sorry. So the anatomy of the elbow is such that we've got these bands on the inside of the elbow here, and they represent the UCL, or the ulnar collateral ligament. And this is the structure that tends to get stressed and injured throwing a baseball. Now, when we have these injuries occur, like Andrew's 2007, he was talking about there's an increasing number of youth and high school players that are enduring these injuries. And it's a 200% increase since the year 2000. Well, we're in 2015, 16 now. I'm sure it's still rising. And then, so the question came up: is it just it's occurring more, or is it just we're becoming more aware of it? So these are just talking about the forces that go into that UCL. So these high velocity pitches that happen, they generate a pretty big amount of force across the elbow. Not really, I mean, it's a large number, that's all you need to know, right? And then the UCL itself can only handle about 50% of that stress and that load. So you can see that it's pretty easy to fail this ligament, okay? So if you had a UCL injury, what are you looking at as far as symptoms? We look at, they complain of soreness, pain at the elbow, area of the inside of the elbow, soreness when they're throwing, when they're increasing their velocity. They may feel a pop. That popping sensation could be like some of that. So the ligament could be like really, it could be like the straw that broke the camel's back. I mean, because you got all this stress that's going on when you're throwing a baseball from youth. And finally, if you keep throwing frequently and hard, and then you can eventually start having, an acute rupture here. Loss of velocity. They're going to tell you they can't throw the ball as fast. And then again, that numbness and tingling. They could get into that pinky and that a little bit of the ring finger there. And then they'll complain of, like, they have like those muscles that span the elbow and come into the wrist. They'll start talking about they have pain there. It's like, this hurts. So the treatment depends on the severity. So what we're talking about is, conservatively, if it's an injury, we like to try to recommend that the younger athletes rest from throwing, pick up PT, again, 4 to 6 weeks at least until there's no pain. And then in surgical cases, when we're talking about the older athletes and athletes that have sustained this, they'll talk about doing a surgical intervention. Andrew's, I got a number from him. He said 74% of his UCL repairs at about 17 years old, 74% success rate. So, you know, that to me, if I'm looking at it, I'm like, 74% isn't a really great thing I will want to go through in the first place. So if I'm stressing my elbow, and I can think of if I'm a 17, 18-year-old and I have 74% of a success rate, I'm not really buying that. I don't like that too much. And then finally, they could do some PRP, does everybody know PRP injections? Okay. Plasma, platelet-rich plasma. Yeah, sorry. I get the plasma and the platelets reverse. Anyway, they use those to help in the healing process of like an injured structure, and ligament and tendons and stuff like that. Hope I didn't lose my battery. Okay, so how can we avoid these injuries to the elbow? Well, first of all, you got to listen to your players. And by that I mean, like if you've got somebody that's throwing, they have pain at rest and they have pain at throwing, you have to stop. You can't subject them to any more stress to their elbow. If they have pain at rest, but then it improves when they're throwing, you just monitor the number of throws they do. If they're having pain, no pain at rest, but then they're pain when they're throwing, then you just have to kind of like keep that intensity below what their pain threshold is. So just make sure they can throw, but below when they're starting to describe the pain or report the pain. And then you got to, if you have pain only after throwing, then you go ahead and take a day off. You need to take that day off, and then you can resume the following day. But you got to, and you can't progress if they're still having that pain. Okay, does that make sense? And then if there's no pain at rest or they're throwing, return to competition. But a lot of the other things that we do in the Sports Medicine Center is we have to correct and we have to optimize the whole body movement system, the quality of how we move. And that starts at the feet, because when we throw a baseball, we've got to push through our feet to throw the ball. We've got to have some integration of the hips, through the core, through the shoulder blade, or what we call the scapula, and then through ball release. Okay? And then as well, so we do some strengthening. And overall fitness, I think, is a really big component that I think is missing in the baseball community. We can work on a lot of things, but then I'd like to just see the kids just be in better shape. That doesn't necessarily mean you have to, run poles all the time, but I think it's a good practice to just, be in better shape. That's all. Have a higher capacity. So now we can get into these risk factors. So the first one we talk about is, if your throwers complaining of arm fatigue, if they're tired, that's absolutely a risk factor. I mean, if they're tired, they don't throw anymore. Recently, we've come across throwing too many innings. If you're throwing more than 100 innings per year, that's going to be a risk factor, absolutely. Inadequate rest. The current things that I've been reading, it's talking about 2 to 3 months from throwing. 4 months, if you can, try to get 2 to 3 months. I know that sometimes that's not being done. Absolutely 4 months off from competitive pitching. So get them off the mound for the 4 months. And what's interesting is one of our participants tonight, we were talking about Pitch Smart, and that's it's the new organization that's come up with these really good ideas. But one thing that I'd heard about that was a little criticism is that they're still not monitoring. I lost my signal. They're not monitoring still the scouting. They're like turning a blind eye to what's going on as far as the scouting goes. And so I just heard a good colleague of mine say that what he feels, and sounds like a great idea, is it should be mandatory that the scouting teams